Ladies and gentlemen, boys and girls, my name is Subrata Sarker. I'm a mechanical engineer working in manufacturing industry more than 2 decades. Today I'll be discussing one of the fastest growing industrial sector in India. That is the pharmaceutical or the healthcare industry in India. This is one of the fastest growing sector at this moment. The CAGR, the compounded annual growth rate of these healthcare industry is about more than 17%. And the total turnover done in 2017 by healthcare industries in India is 160 billion US dollar. And the largest FDI, actually foreign direct investment received in India, actually that is also for the drugs and pharmaceutical industry. And if you go by the employment provided by the different sector in India, say more than 50% is employment from the agriculture industry, 11% from the manufacturing industry, say for 11% from the construction industry. In the same way, healthcare industry is providing the 4% of India's total employment. That is a big, actually, being a sector is doing that much. And there are many sectors which are interconnected with the healthcare industry. For example, say insurance, the healthcare medical insurance companies, and they are also doing great, actually, which is the secondary industry for the healthcare industry. The CAGR for the medical industry is basically 22%. This is a great, actually, and the premium collected in last year 2017 in India, it is about 6 billion US dollar, which is a very big amount, actually. But there are two sides or two different chapter for the healthcare service provider in India. One is the government sector, one is the private sector. There is different, a hell lot of difference, actually, between this the facility and the caring they are provided and everything. There is a huge difference, actually. Like the cost of the healthcare or treatment in the private sector is more than say 4 times, 5 times more than the government sector for the same treatment, same diseases, and but still they are doing a very professional way. So 70 to 80% people are still going into private sector and of the treatment, and day by day private sector are getting improved very much, and the government hospital etc. are not improving, actually, day by day. And if you see by numbers, there are 15,000 big hospitals in India. I'm not considering the small nursing home etc., which you will find a lot of it in many cities and villages. I'm not considering. Big approved certified hospitals in India is about 15,000, and there are 8.75 lakhs hospital beds in those big hospitals. So these are the very big infrastructure, actually. And if you see the there is one much scope, actually, future scope of the business, that is said that health insurance, actually in India 18% people are having only health insurance, 82% people are not still getting the health insurance. So in health insurance companies, CAGR in future will be much more, say more than 20%, like 25%, etc. But these companies are, say, Max Life, SBI Life Insurance Company, Tata, AIA. These are the companies, Kotak Mahindra. So they are doing a great, actually, in this sector. But I have only one suggestion. If someone is going for any medical insurance policy, there is one factor you will check in the internet for that company for whom you are going to do this medical policy. That is the claim settlement ratio. What is the claim settlement ratio of that company? That's very important, actually. And if a company doesn't have more than 95% claim settlement ratio, don't go for that company. You can check for last 3 years data. You will get in the internet easily, actually. Like there are some companies like HDFC Life, say SBI, they have gotten 97-98% claim settlement ratio. That's very important factor, actually, when you are going to finalize with any medical policy. But there is another side which is not very good, actually, like government. From government side, healthcare industry contribution is very poor. You can see here in this graph, India's budget for healthcare industry is the least. Even it is lesser than the Bangladesh. Bangladesh has got more budget than India. So this is another bad side, but nevertheless, because the private industry is doing great in this healthcare industry. So, and in summary, the total ways, actually, there India's healthcare industry is one of the fastest growing, that I say that 18 to 17% compounded annual growth rate. So if you summarize all these information in a single page, so healthcare, the summary will be that in the turnover of Indian healthcare industry is 160 billion US dollar, and the CAGR is 17%. The contributing total GDP of India is by 5%. Healthcare industry is contributing 5% in India's GDP, and total employment provided by healthcare industries in India is 4%. And the health insurance industry's premium collected in last financial year is 6 billion US dollar, and there are 8 lakhs practicing doctors in India. There are 15,000 big hospitals in India. There are 8,75,000 hospital beds in India. There are 7.5 lakhs professional nurses in India qualified, and there are 170 medical colleges in India. There are 3.5 lakhs retail pharmaceutical shops in India. There are 18,000 new doctors are passing out in every year from India. So if you find this information is interesting and informative, you can share with your friends. And if you have not yet subscribed my YouTube channel, you can subscribe my YouTube channel by clicking on the bell icon so that you can get the notification of my upcoming videos. Thank you very much for your attention.